Hello, everybody. We are doing a Jimbos seminar tonight via Instagram Live because we cannot be in person to do these seminars anymore. So for those of you that don't know me, my name is Dr. Megan Strodel, and I'm a naturopathic doctor in the area. I have a practice in Encinitas, California, and Jimbos is all over the Southern California area. So hi everybody. So I know a lot of you guys who come to the seminars. I'm going to give some people some time to pop on. Hello everybody that's joined. I have my trusty whiteboard here in front of me. We're going to be talking about thyroid tonight, and essentially just do a deep dive into Thyroid 101 is what I call this. So everything that we possibly need to know about the thyroid, because a diagnosis that's really common nowadays is something called hypothyroidism, which is meaning that you have a slow thyroid for many different reasons. So everybody grab your water bottle. We're going to dive in for the next 30 minutes-ish. And then I'm also going to open up the floor for questions. So if you guys have questions, comments, really anything related to thyroid and hypothyroidism, then we will go over it. But I really like to do these seminars because I really like to teach people how their bodies work. I find that when we understand how our bodies work, we're better able to make decisions for our health if we have all of the information. So it is hot here in San Diego, huh, guys? Okay, I think we are ready to roll. So first of all, I really wanted to start talking about how the thyroid works, because I know a lot of you guys have probably had a thyroid panel at some point in your life. What is standard of care is to have what's called a TSH run on your blood work, and then sometimes that will reflex to a T4 measurement. And TSH is your thyroid stimulating hormone. This is the brain's opinion on what the thyroid does. So this is the signal from the brain to the thyroid gland to get the thyroid gland to make thyroxine or thyroid hormone. And then once your thyroid gets that TSH signal, then it has to make actual thyroid hormone, which is T4, and then T4 gets converted into its active form T3, and then that's what your cell uses. So a standard panel is going to have just a TSH and a T4, but I find that that doesn't always give us the full picture of somebody's thyroid function. Which is actually a problem when we're trying to figure out, if you have hypothyroidism, why is your hair falling out? Why are you gaining weight? Why are you losing the lateral third of your eyebrows? Why do you feel puffy? Why do you feel tired? Why are you constipated? Those are all really, really common signs of slow thyroid. Also, dry skin is one of them too, and that's one that we commonly forget, and I often forget. Because dry skin is something that's so common, but dry skin can actually be a thyroid issue. So let's first talk about basic thyroid physiology. And I have some tools. Because what your doctor has run for your thyroid panel isn't fully complete, and I want to show you why. Okay, let's see how you guys can see this. Okay. Awesome. So we have, gotta go over here. We have the brain, and this is all going to be opposite in Instagram Live, so I apologize. So we have the brain, which gives the signal to the thyroid gland called TSH, which is thyroid stimulating hormone, and then your thyroid takes that signal and responds to it to make T4, and then T4, see if you guys can still see this, T4 goes into T3, which is your active thyroid hormone. T3 will then do a final conversion into free T3, or what we see on labs as FT3. See if you guys can see this. And your free T3 is what actually goes into the cell and makes a happy cell and allows your cells to function. Because the point of the thyroid gland is to give us thyroid hormone so that we can have a metabolism. It's essentially the way that our cells can use energy. Your thyroid makes thyroid hormone, which is your metabolism. It powers all of your cells. So if we don't have enough thyroid hormone, then often your whole metabolism is just totally either shut down or just really, really slow. And so that's why people will get things like dry skin, constipation, hair loss, weight gain. And so when we are looking at a thyroid blood panel, your doctor's typically only running a TSH and a T4. But one really important step in the thyroid physiology is when your body takes, let's see if you guys can see this. It's when your body takes T4 and converts it into T3. And we talk about T3 a lot because T3 is your active thyroid hormone. So if we have the precursor to T3, which is T4, but not enough actual T3 that your body's able to convert, often our bodies just don't do well and we can have signs and symptoms of having slow thyroid. So a lot of people that get a traditional workup of a TSH and a T4 on just their standard yearly labs are actually missing part of the picture, and hypothyroidism or slow thyroid is often going undiagnosed. And you can also have a condition where you have essentially a subclinical, so it's not a decrease in thyroid that is necessarily clinically significant on labs, but it's lower in the reference range. So we're seeing that the amount of thyroid hormone is enough, but you're showing thyroid symptoms. And so sometimes we will do some sort of intervention with the thyroid hormone for those types of people. But if you don't run a full thyroid panel, you're often going to miss those people. Often aren't going to get any sort of help or diagnosis because you can have a normal T4 and TSH, but not a normal T3. And so some people are struggling to get any sort of help, but it's not traditionally run by doctors. I am a naturopathic doctor, and so part of what I do is a lot of comprehensive testing, whether it's a lab test or a stool test, poop test, urine test, but I will usually run the whole panel for everybody so that we get to see the whole picture of what's going on with your thyroid. So I'm going to run more than a TSH, I'm going to run more than a T4. I'm going to run the free T4, I'm going to run the free T3, I'm going to run the T3, so that's going to make a big difference in figuring out if you actually have a thyroid issue, because all those symptoms that I was listing off, those can also be indicative of having some other issue. You know, hair loss can be caused by a lot of different things. Weight gain can be caused by a lot of different things. So can dry skin, so can constipation. So that's why some thyroid disorders are hard to diagnose, because a lot of their symptoms are consistent with other diagnoses. I'm hoping this is all making sense. Shoot me a thumbs up if you guys are getting this. So the other thing that commonly goes undiagnosed or not run on a blood panel is antibodies to your thyroid. Awesome, guys. Thank you. Antibodies to your thyroid. If you have antibodies against your own tissue, then that means that your tissue is essentially inflamed. It's under attack by your own body. And most of you guys know that autoimmune disease is generally pretty serious, and you can have an autoimmune disease to your actual thyroid gland, different parts in your thyroid gland, and that changes and diminishes your thyroid function. It can also sometimes temporarily increase your thyroid function, but in a bad way, not in a way that we want. And so when we're doing a thyroid panel, it's really important to get thyroid antibodies run. And this is something, let's see, something called, let me use another color. I think this one's kind of done. Let's try blue. Something called anti-TPO and anti-TG, or thyroid globulin. So anti-TPO anti-thyroid peroxidase, and anti-TG, anti-thyroid globulin. Oh, it's a tongue twister. These are antibodies against certain parts of your thyroid, and these markers, if these are elevated, these indicate an autoimmune thyroid process. And that's really important to get a diagnosis for this, because some people will have normal thyroid hormone and a normal TSH, but they actually have abnormal antibodies, and they're wondering why they feel so poorly. You know, they're inflamed, they're tired, they're fatigued, they're brain foggy, they're not losing weight, they're just in general not feeling well, but their thyroid problem isn't getting diagnosed because these numbers aren't commonly run. And this is really, really common, you guys, especially in women, especially in your, I would say sometimes 30s, but 40s, 50s, 60s is where I'm commonly diagnosing this for people. And that's usually because women are more prone to getting autoimmune disease than men. So I'm trying to think if I've ever actually seen a autoimmune thyroid in a man. Nobody comes to mind actually, which just kind of goes to show you how common this is in women. But you know, if you have this underlying thyroid condition, then we need to treat it, because usually there's a trigger for an autoimmune process, whether it's MS or celiac disease or lupus or a autoimmune thyroid problem. Usually there's some precipitating event. So for a lot of women, because this is so common in women, pregnancy is a big trigger. Postpartum thyroiditis is what this is called. But it could be anything. It could be you traveled to Mexico and got super sick, and that was the trigger. It could be you got an infection from somewhere. It could be you got super stressed because you were juggling too much in your life. It could be you got exposed to some toxin or heavy metal that overwhelmed your system. It could be, let me see if I can turn some of these off. Okay. There's just so many different things that can trigger an autoimmune process for the thyroid. And people can go with an undiagnosed thyroid issue, especially an autoimmune thyroid issue, for years before they are actually getting the proper diagnosis. I see a lot of women who have been on thyroid medication for a really, really long time, but they still aren't really feeling that much better. And then when they go see a doctor that actually runs those thyroid antibodies and finds that they're positive, then we're actually able to treat the autoimmune piece of the thyroid, not just the lack of thyroid hormone that people have. Hope this is making sense for you guys. Hopefully we will get something like this posted so that you guys can see it. I'll take a photo of this when I'm done. But when we are working up the thyroid to see if you have a thyroid issue, we need to run the whole panel. So we need to have a TSH there, a thyroid stimulating hormone. Write this down, you guys, if you need a good thyroid workup from your doctor. We need a TSH, which is thyroid stimulating hormone. We need a T4, which is a total T4, a total thyroxine. This is the thyroid hormone that gets converted into your T3, which is your active thyroid hormone. So we need a total T3. We need a free T4, which is our active T4. We need a free T3, which is your active T3. And your free T3, you guys, is the marker that most doctors do not want to run, but it is probably the most important. Definitely the most important, because that is the actual molecule, that is the actual thyroid hormone that your cells take up and use. So very, 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 very important. And then you also want to ask for thyroid antibodies. So anti-TPO, anti-TG, very, very important. So that is what I consider to be a whole thyroid panel. And then if you are going to a doctor who's very progressive, or a naturopathic doctor, or somebody else that really knows what they're doing with thyroid, sometimes they will run what's called an RT3. See if you guys can see this. An RT3, which is a reverse T3. And what sometimes happens in the body when we are under stress is that the body needs to shunt all of its physiological functions to help you to run away from the bear. if you are really stressed. So, and this could be whatever stress, physical, mental, emotional, spiritual. Doesn't just have to be, something hugely traumatic like a car accident, surgery, or something like that. It can be anything, whatever the body perceives to be stressful. Sometimes your body will, because it's trying to shunt all of your energy to running away from the bear, it will take some of your active thyroid hormone and actually inactivate it. It will take it and run with it the wrong way. And what we see then is that reverse T3 levels go up, and your total T3 and or your free T3 levels will go down. So what that means is that you have less active thyroid hormone to use, and it's all getting bound up in a reverse T3, which is not usable by the cell. We can't use reverse T3. And that's kind of a bummer, because we want to have a good metabolism and we want to feel well. And so if you are really, really stressed, your body's going to do that to protect you. But then you also feel kind of sick because you don't have enough thyroid hormone. So it's your body's way of compensating and protecting you. But sometimes stress is people's reason why their thyroid isn't making enough hormone, or why their hormone is being bound up in reverse T3. So for certain people, I will run a reverse T3 if I'm sensing that could be going on. Having too high reverse T3 and not having enough of the active thyroid hormone, the free T3. And then a very small subset of people have an overactive thyroid. And this is definitely not as common as a hypothyroid situation, but it does happen. The most common thing that I see happen is that people will have antibodies to their thyroid, and this is causing some destruction of the actual thyroid gland, which is causing some dumping of thyroid hormone that's stored in the gland. And so you're seeing ups and downs of thyroid hormone, which is making you feel really hyped up or really low, or really hyped up and really low. And some people can cycle like this when they have an autoimmune thyroid issue. This is called Hashimoto's thyroiditis. And not everybody with a Hashimoto's picture is going to cycle like that. But some people will report to me they feel really great some days and they feel really horrible other days. And that's always a sign to me, hey, we need to check your antibodies. Maybe your antibodies are too high. Maybe you're on this Hashimoto's roller coaster, and we need to figure that out. So sometimes people have a fast thyroid for a short period of time, but it's not pathological in the same way that having a truly overactive thyroid is. Some people have something called Graves' disease, or they have just, in general, overactive thyroid. Graves is an autoimmune thyroid. You can have thyroid storm and all of that, and that's a whole nother topic, but having an overactive thyroid, a truly overactive thyroid, is more rare. So the patients that I deal with are usually all on the low thyroid spectrum. But the good news is that we can do so much for you guys. There's so much that natural medicine can do for you. What's typically done for people that have a slow thyroid is that they're put on thyroid hormone medication, and you can be put on a natural or a synthetic thyroid hormone medication, and both can be really good. It doesn't matter to me which type of thyroid hormone you're put on. I think there's a lot of debate about whether a synthetic version or a natural version is better or worse, but I will tell you, based on experience and all of the reading that I've done and all my work with patients, is that it really matters who you are. So it's very patient dependent. So some people do fantastic on a natural thyroid replacement therapy. Some people do amazing on a synthetic replacement therapy. And it just depends on the person. So usually when we're treating thyroid, when we've decided that you need thyroid hormone, we will pick one and see how you do. And we monitor you with labs every 6 weeks, and also by symptoms, which should be improving. Hold that thought. Now, excuse me. Now, some doctors are not willing or they're not educated in prescribing a natural thyroid type of hormone, replacement hormone. Excuse me. So if that happens and you feel like you need a natural thyroid replacement hormone, then you just need to go see a naturopathic doctor in the area who knows how to dose a natural thyroid. It's really not that much different than a synthetic thyroid. The synthetic thyroid that's the most common in this country and is probably one of the top 10 prescribed drugs in America is called Synthroid, which is just levothyroxine or T4. And it's just made in the lab versus being extracted from a pig thyroid gland. A natural thyroid hormone is taken from pig thyroid gland, and it's been purified and standardized. So yes, it is the same exact thing as a synthetic version. A lot of doctors will say that it's not, but it is actually. So I use both with patients, but not everybody that has a slower thyroid or has a thyroid issue or has an autoimmune thyroid problem will be getting thyroid hormone. And that's really, really important because if you have low thyroid numbers, sometimes they're not low enough to merit giving you thyroid replacement therapy, but sometimes they are. So let me talk about a couple of things that will help, that can help with thyroid. And I'm gonna wipe this off. Hopefully this works. I might just smear it everywhere. Oh, well, I tried. I tried really well. Oh, that's not too bad. That's not too bad. Okay, so these are some nutrients that I use with my people that have slow thyroid and thyroid issues. They're generally safe for everybody to take, but I do recommend in general with supplements, you guys, to ask the person that is part of your care team, whether it's your acupuncturist, your chiropractor, your naturopathic doctor, your medical doctor might know a little bit about supplements, though I don't generally recommend you guys ask them because they tend to not be as supplement friendly as some other natural practitioners. But have somebody that knows what they're doing, whether it's a naturopathic doctor like me or somebody else that's holistic in your care team, look at all of the supplements that you're taking, because I see a lot of people taking too many supplements or supplements that are totally going like this and canceling each other out and having, a multiple purpose that's just, going all which way. So I definitely don't recommend just going out and buying these. Run this by your doctor. This is just some information to help you guys know that there's other treatment options than just, say, going on a thyroid medication immediately. Or even for some people, they have to remove their thyroid gland, like in the instance of an overactive thyroid, and there's more options for you. There's not just surgery. So I get pretty passionate about that, if you can't tell. Okay, so one of my biggest favorites for thyroid health is selenium. Selenium is a mineral, and it's needed for the conversion of T4 to T3. So it's taking your main thyroid hormone, your T4, and converting it into the active thyroid hormone, which is T3. And so if you don't have enough selenium, then it's really hard to make that conversion. Selenium you can find at Jimbos. There's multiple different types that they carry. And if you take any sort of thyroid supportive supplement, you're going to see usually selenium in the supplement as well. Let's see, what else can I say about selenium? It's a mineral. Usually we get it in like leafy vegetables and anything that's grown in the soil. But the more industrialized we get, the more decreased in nutrition our food is. So often we will need to do a supplement. So selenium, I will sometimes dose twice a day for people when we're trying to lower their antibodies or we're trying to get them to convert better. And I'm not going to talk about specific dosing on this, you guys, because we just can't do that on the internet, but I will tell you what is up, what options you have. So selenium, let's see, zinc is another one. Zinc's been pretty hot right now with all of this coronavirus stuff, because zinc is helpful for your immune system, but zinc is also needed for your thyroid. So if you have low levels of zinc, one thing that you can actually do is look at your fingernails, you guys, to see how your mineral status is doing. If your nails, let's see, vertically like this, if they are really, really ridged, then you might have a mineral deficiency. And I'm meaning vertically like this, you guys. If you have lines like this on your nail, that is usually something totally different and often pathological. So I'm talking about the up and down ridges on your nails. Your nails should be smooth and they shouldn't be super ridgy. So if you have some really noticeable ridges on your nails, it can just be a sign of just global mineral deficiency overall. So zinc, the reason why I was talking about the fingernails is because if you have a bunch of little white dots all over your fingernails, or you tend to get canker sores in your mouth, or you tend to get sick really easily, you could very well have a zinc deficiency. Those are all signs of a zinc deficiency. So zinc is very, very, very important. You get zinc in, let's see, let me give you some food sources for these. For selenium, my favorite food source is Brazil nuts. And for those of you that are just kind of popping on, we are going to do question and answer at the end, which we are nearing. Brazil nuts, zinc, pumpkin seeds, you guys, for zinc. If you eat a 1/4 cup of pumpkin seeds every day, you're going to get all the zinc you need. So Brazil nuts for selenium, pumpkin seeds for zinc. Pro tip on the Brazil nuts: don't get the Brazil nuts from just anywhere. Make sure on the package it says source Brazil, because the reason why Brazil nuts are called Brazil nuts is because they came from Brazil traditionally, or I should say originally, and the soils in Brazil were really, really high in selenium, and probably still are, and that's why Brazil nuts are so just high in selenium. So Brazil nuts, usually like 2 to 3 a day. When you get a really high quality Brazil nut is all you need. So that's super awesome. Let's see what else. Vitamin D is important for thyroid function, and for those of us that are in San Diego, often we are vitamin D deficient because while we are outside during the summer, we are inside a lot of the winter in the air conditioning, or just when it gets dark out. So we don't always, as a general population in San Diego, have enough vitamin D, even though technically, due to the latitude and longitude of where we live, we can make vitamin D all year. So definitely get your vitamin D checked. It does affect your thyroid function. If you have lower vitamin D, then we know that your thyroid just doesn't work as well. So normal levels of vitamin D in your blood should be 60 to 80. 60 to 80. And the typical range for a vitamin D is around 30 to 100 on a basic lab. So 60 to 80 and 30 to 100 is very, very different. So just, go home and look at your vitamin D scores that you hopefully got ran soon. And if you've never had a vitamin D level run on yourself, then definitely run a vitamin D level on yourself. Ask your doctor. That should be a pretty easy ask, you guys. Selenium, vitamin D, zinc. Let me talk about one other thing. If we are going to just have some general support for the thyroid, I'm often going to use different herbs, or things that are going to help with thyroid hormone conversion, or things that are going to help with actual assembly of the thyroid hormone in the thyroid gland. So there's a product called, let's see if you guys can see this. If I go lower, yeah, you guys can see this. You can get this brand almost anywhere, Gaia brand. They have a thyroid, whoops, they have a thyroid support capsule that's actually fairly excellent, and I use it with a lot of different people. It has ashwagandha in it. I think it has some kelp in it. I'd have to look at the bottle. I don't have it in front of me. But it's really, really great for helping address any sort of conversion issues from T4 to T3 to get active thyroid hormone levels to improve. So that is a supplement I really like to go to. But we always have to think about the basic, you guys. Yeah, available at Jimbos. All these are available at Jimbos, you guys. Jimbos carries a lot of really awesome stuff. So let's see, where was I going with that? But that's kind of that's where I start for people that have a slow thyroid. Sometimes I will give people just straight up ashwagandha as well, because ashwagandha is an adaptogen. Adaptogen is a type of herb that helps you adapt to your environment. So it either gives you a little bit of energy or takes away energy. It helps with sleep initiation and maintenance. It helps with thyroid function. It helps with your energy levels. With men, it helps with your testosterone levels. It can help with sex drive. Ashwagandha is just one of those really amazing herbs that's great for almost everybody. So sometimes I will give people ashwagandha to start off with, because usually people that have a thyroid condition also might have some adrenal dysfunction, or they have some insomnia going on, or they have some stress in their life. And so the thyroid gland, it's located right here in your neck. So energetically, I like to think of your thyroid is exposed to a lot of crap, whether it's negative energy, whether it's different traumas on our neck, and it has like a really giant blood flow coming off of the vessels that are running from your lower body up to your head, and are draining your head too. So the perfusion, the blood flow to your thyroid is quite massive. And so if there's any sort of like toxin exposure or anything wrong with the blood, any sort of deficiency, it's really going to affect the thyroid gland. I think of the thyroid as being like the bratty child that tends to just be finicky. The thyroid gland is a little sensitive, and sometimes it needs a little bit of help. So that's why we run a full panel, a full lab panel. That's why we start with some basic all-natural treatments first. That's why we look at any underlying causes like having an adrenal issue. When we're talking about the study of hormones in general, there's three main systems that all kind of come together. The thyroid system is what we were talking about tonight, and then there's the adrenal system, and then there's your sex hormone system. So whether you're a man or a woman, you have ovaries or testicles, and then all of us have adrenal glands, and then we all have thyroid glands. So those are the three kind of main pillars for our whole endocrine, our whole hormone system. And so if one of those pillars are off, it's going to essentially make a really, really shaky stool for us to stand on. So I never think about these things in a vacuum. So say that you've been diagnosed with a thyroid issue, or you think that you have a thyroid issue. It's really important to look at all the other factors in your life, because you could actually have an adrenal issue. I see this really, really common with thyroid patients. So I could talk forever, but I do want to open up the floor for any questions. There's been about 15 to 20 people listening, and tons of people just popping on and off tonight. So this has been awesome. While the questions are coming in, a little bit about me. I'm a naturopathic doctor. My practice is in Encinitas. I work with a lot of women, ages, young, up to ages 80, 90. So I treat a lot of different things. I treat thyroid, obviously. I work with everybody with their hormones, adolescents, women that are in menopause, women that are trying to get pregnant, the whole gamut. I work with a lot of people with their anxiety, depression, getting periods on track, getting GI health back on track. That's a big one, you guys. Constipation, diarrhea, SIBO, tummy pain, all of that. And you can come see me. I have openings in my practice if you need some help. And I'll post my info after so you can find me if you need to find me. How do you know if it's an adrenal issue versus a thyroid? Excellent question. So, it's hard to explain this without necessarily showing like a symptom chart comparing. I can pick this out because I do this as my job, but adrenal, with any sort of thyroid issue, there's usually some amount of adrenal involvement that I'm working on as well. But people that have adrenal dysfunction usually have some issue with their sleep and their circadian rhythm. So typically they're waking up and they're just not feeling well rested. They're feeling really draggy and groggy in the morning, and they need some sort of stimulant or coffee to get going. And then they feel good until they have some sort of crash around 2, 3, 4 p.m. And then after they've maybe done a stimulant or a snack or something, a nap, then they're okay till about past dinner time, and then maybe they will tank again, or sometimes they'll get a second wind and then they'll stay up a little bit too late. So sometimes it's just, I can tell by how their day is. People that have low adrenal function often have stomach acid issues, lower stomach acid, so they have a hard time digesting food. So these people are usually nauseous in the morning, and they usually don't like to eat breakfast. So that's a sign of adrenal issues. Sometimes I look at people's hair and nails to look at mineral deficiencies. If you're low in stomach acid, then you're often going to be low in minerals, because minerals are essentially like really, really, really tiny rocks, right? And rocks would be like the hardest thing to digest, and you need a lot of stomach acid to digest stuff. So if you have low stomach acid, it's hard to get the minerals out of your food. People that have adrenal issues usually are on, like, they need something to keep them going, whether it's a stimulant, sugar. People with adrenal issues sometimes have salt cravings. They will sometimes have fat cravings as well. They feel better on higher fat food, whether that's good food or higher fat bad food. People that have adrenal issues usually have some blood sugar abnormalities, so their blood sugar is going up and down. By the way, if you guys are tuning in, I'm taking questions right now, so feel free to chime in, because I'll get to the next one after this. So people with adrenal issues have blood sugar imbalances, so they can be hangry a lot, so that type of hunger where you're like, oh my gosh, I'm suddenly really hungry, feed me, or I'm gonna get, emotional about it. I call it hangry, where you actually get a little angry about it. It's cute, but being hangry is actually one of the worst things that you can do for your adrenal glands. Having rock steady blood sugar is actually one way that I will heal an adrenal issue. But a lot of people don't know that they have issues with low blood sugar and hypoglycemia, just because it's just so common to get tired and irritable and cranky and low energy in between meals, but that's actually a symptom that you have a blood sugar imbalance, and that's not good. You should optimally feel great after you eat, and then that feeling sustains itself until it's around the next meal time, which is about maybe 4 hours later, and then you're like, maybe I feel a little bit hungry. Food does sound good right now, but I'm not like, oh my gosh, I'm so hungry, feed me. So the other way that I can tell is just by running labs, if it's an adrenal versus a thyroid issue. All those history things usually help me pick out if it's an adrenal issue. People that have adrenal issues too usually have some sort of history of stress in their life, whether it's been in the past, or as in 5 years ago, or whether it's been recently. So sometimes we'll run labs like a serum DHEAS or a cortisol level, and see if it's their adrenals. Sometimes we'll do a 4-point cortisol curve through the urine to look at cortisol clearance and cortisol output and the balance of cortisol and cortisone to see if you're even activating cortisol and able to use your cortisol. So I look at all of that to assess for adrenal dysfunction. But all those clues usually tend to tip me off. But super great question, Miss Gina Marie. Anybody else? We're wrapping it up. Questions about thyroid, questions about thyroid testing, questions about natural treatments. I'll give people a couple seconds. And then if you guys have any other topics that you want me to do on one of these Jimbos seminars, definitely shout them out here too, because I like to do these seminars at Jimbos. They're a lot of fun. Okay, we're gonna wrap this up, you guys. So for the 13 of you watching, any last questions or things to say, questions for me in general, questions about the subject, questions about Jimbos, questions about finding products. This is the time to pick my brain, so take advantage. Yeah, great question. What are your office visit / consult fees? Do you take insurance? So I'm a naturopathic doctor, which means that the insurance coverage for me is different than your standard medical doctor. In the state of California, we are not allowed to take insurance for to cover our office visits. So office visits are always cash. And then sometimes we can get insurance coverage through labs. Sometimes I will give people super bill that they can submit to their insurance, but usually I just do cash price for labs. That way we don't get caught up in the whole figuring out if your insurance will work with the lab, and if you get charged too much money, and if the lab takes it, and sometimes it can be a little bit of a hullabaloo. But first office visit for me is $250. It's going to go up to $300 eventually, because I'm going to increase the amount of time I see everybody and kind of up my price a little bit. But $250 for the first visit. We usually do some lab testing after that, whether it is blood, urine, stool, if we need that. I always recommend that if you have a good relationship with your doctor, contact me before you come see me and get a list of stuff that we could possibly have your doctor run for you, and then go get the blood work done and then bring it back to me. So then you can save some money on labs. But the full panels that I run is pretty comprehensive, and it's fantastic. Usually costs anywhere from $200 to $300. $250 is the usual cost-ish, around that. And we get a lot of super great information. So I've never had anybody pay money for labs and regret it. Let me just say that. Someone else, having Hashimoto's, how can you support your thyroid during pregnancy? Oh my gosh, such a great question. So when you're pregnant, you can still take a lot of the minerals that I was talking about, like selenium, zinc, vitamin D. Those are all safe in pregnancy. If you have Hashimoto's in pregnancy, I would really just recommend treating it with diet. One of the biggest things that you can do for Hashimoto's is figure out if you have any food allergies and or remove gluten, dairy from your diet. Gluten's probably the biggest one because it has molecular mimicry with the immune system. So gluten can trigger some of that thyroid fire and the Hashimoto swings, and bad news bears for Hashimoto's. So I would definitely do it, support Hashimoto's through diet with pregnancy. But, if you have Hashimoto's and you haven't quite found the trigger, I would maybe consider thinking about that as well. Because say you have some gut issue that triggered Hashimoto's, which is super common, you guys, then you can drink bone broth when you're pregnant. You can put turmeric in your food, things like that. You can take aloe. We're going through questions, you guys, so this is the time to get them in. Going back to the rigid nails, what minerals are people typically deficient in? Oh gosh, honestly, it could be everything. When I say people are mineral deficient, I usually mean, it can be magnesium, it can be calcium, it can be selenium, it can be molybdenum. That's a really common one. If you are burpy, belchy, bloaty, farty after broccoli, cauliflower, and all those cruciferous vegetables, you might have a molybdenum deficiency because you can't process the sulfites in those foods. So You know, I would say out of all the minerals that people are deficient in, I mean, I see it for everything, to be honest. I see people just deficient in salt too, because I think we're kind of afraid of the whole sodium issue. And if you get a really nice quality salt, you get a lot of trace minerals with it. So sometimes I will put people on, kicking over my water bottle, some people will put on an actual mineral supplement capsule for like a month or 3 months, something like that, just to get some of these minerals in. If you're deficient in minerals, one thing that I see is that without any other pathology compounding this, is that you drink a thing of water and the water just goes right through you. You feel like you're peeing all the time. Think minerals help hold the water in your body. So if you are deficient in minerals, you're just gonna feel like you're peeing everything out. Like, say you drink an 8-ounce thing of water, like, you know, are you gonna go to the bathroom within the hour or after the hour? So you should be going to the bathroom after the hour when you drink 8 ounces of water. So to answer your question, magnesium is such a big one, but I see calcium. I see it be calcium. I see it be selenium. I see it be molybdenum. I see it be boron, like weird stuff. I love Jimbos so much. Please open more locations down south. Woot woot. Where do you want it open? Send some feedback to Jimbos, because I'm sure they will love the feedback. Jimbos is really great with feedback. Okay, guys, there's 11 of you on here. This is some time to pick my brain before we finish up. Any last questions on thyroid? Don't be shy. For those of you that want to connect with me and figure out what I'm all about, you can find me on Instagram at DRMEGND. My name is Dr. Megan Strodel, but I go by Dr. Meg ND almost everywhere. So if you remember DRMEGND, then perfect, Anita. Contact info. If you do DRMEGND, which is Dr. Meg ND, you will find me everywhere. You will find me on Facebook, you will find me on Twitter, you will find my website, you will find me on Instagram. I also have an email list where I email out lots of random cool stuff, recipes, stuff I'm thinking about with patients. Sometimes I do private Zoom calls with my members, with my subscriber list for topics that can't be put on Instagram due to censorship, which is a big thing nowadays. So being on my email list is fantastic. But yeah, I'm very active on Instagram, and I do Instagram lives on my Instagram every Monday night at 5 p.m. Pacific time. So you can always interact with me more on there. But my website is all the W's, drmegnd.com, drmegnd.com. And I'm right in Encinitas, right off of El Camino Real. If you guys know where Healthy Creations is, which is delicious, right across the street from there. I'm probably closest. I'm essentially right down the road from the Carlsbad / Encinitas Jimbos, up in the Forum. And then I'm probably 15 minutes from the Carmel Valley Jimbos, 15 minutes north. So that's how you can be in touch with me. Definitely you guys should all go follow me, because I'm always doing like this. I'm always doing these educational things because it's fun. Have you been able to help reduce high antibody levels? Oh yeah, all the time. Yeah, this is one thing, having high antibody levels doesn't necessarily correlate 100% to disease, or I should say severity of disease. So if you have sky high antibody levels, that doesn't necessarily mean you have more thyroid destruction or you have worse Hashimoto's disease. But in general, if your antibodies are in the thousands, which is I've seen before, 100%, then we definitely want to get that down, because what I typically see is the more antibodies, the more possible destruction. It makes sense in my brain, but study-wise, they haven't found that. So kind of interesting. But oh yeah, I get it down. I use a combo of selenium, finding the root cause, curcumin's fantastic, resveratrol is fantastic, glutathione is fantastic, IVs are fantastic, and sometimes it's diet too. You know, I was talking about gluten before, but if people are Hashimoto's and they're not off of gluten, you're really doing yourself a disservice. So I would definitely get off gluten, and 100%. And if you guys are like on the fence with like, do I have a food allergy to something, or do I need to avoid a certain food, or do I really have a problem with gluten, I can test for all that. I have great tests available to me that, you know, will do a whole in-depth gluten panel to see, you know, do you actually react to gluten? Is this a celiac thing? Is this a non-celiac gluten sensitivity thing? Is this a wheat allergy? Is this a gliadin problem? Is this a specific gluten peptide problem? We can really figure out what the problem is. We can do that with grains, we can do that with lectins, we can do that with eggs and dairy, and figure out what you guys react to. So you can get really cool testing that will give us a lot of information. Okay, last chance. I'm gonna hit end, and this will be available on Instagram Live for 24 hours. It might just post Instagram TV. I know that the team at Jimbos will be working on making this beautiful and reposting it. So for those of you that weren't able to watch the whole thing, then you will totally be able to. And I'll have the team post up my contact info, and you can always find me at Dr. Megan D, Dr. Megnd. And Anita, if you need help with your thyroid, call me. I can help you, and everybody else that's watching. I love helping people out with their thyroid. I personally have had some thyroid issues, and so like I started learning about this back when I was 12-ish. So it's been, can I do that math in my head? How many years? I'm turning 31 this year. It's been all those years of learning about thyroid plus medical school. So I get super pumped up about thyroid. So thank you all. I'm gonna hit end. It was great having you all here. I'm Dr. Meg. I'm with Jimbos seminars because we love teaching people about their bodies. Anyways, that was super cheesy, but have a great night, and we'll do one of these things again. And Jimbos always has these great health seminars, so always tune in. Bye. Have a good night, everyone.